Legends 100.3. It is a South Florida Sunday morning. Mike McGann here with you, and it's time once again for another edition of Business Community Spotlight. And this one I'm really excited about for, well, a couple of reasons. It's extremely important. The topic today, it involves health. It's a very, very important discussion. But beyond that, it also gives me a chance to talk to someone who is based in the Seminole Shops. And you know how much I love the Seminole Shops. You know, I'm right on US 1, just a little bit north of PGA Boulevard. Some wonderful changes happening at Seminole Shops. I love anytime I get to visit it. And I'm talking about Intercoastal Dental. And the gentleman who I'm speaking with, Dr. Alex Gaeta, that's where he makes his home, is Intercoastal Dental. He is a doctor of dental surgery and quite a story. So good morning, Dr. Gaeta. How are you?
Good morning, Mike. I'm well. How are you?
I am well as well. It's wonderful to see you.
Good to see you as well.
And, I'm kind of psyched for this because I know a bit about your background. And there's a thing or two we share, which I'll get into in a bit because it ties into what you do in a way that I don't know if people will expect, but we're going to get into it. So let's talk a little bit about you. You are a doctor of dental surgery. You're a fellow of the International Congress of Oral Implantologists. What does that mean?
Basically, I've spent hundreds, if not thousands, of hours studying dental implants, how to place them, and all surgeries kind of associated and restorative ways of adding a tooth to the implant once the implant is integrated into a person's jawbone.
Now, just for anyone that this is totally new to, what is an implant?
An implant is a titanium screw that gets placed into somebody's jawbone to replace a missing tooth.
Okay.
So if you want a fixed tooth, that's something that doesn't come in and out of your mouth, then it's a good option. Now you can also use them to have a removable prosthetic. So there's a lot of different options that you can use implants for. Well,
options, to say the least. It's certainly come a long way, hasn't it? There's a huge difference between now and even when I was a kid and you're a young man, what some of the dental options were. This is quicker, cleaner, probably a lot healthier too.
It's a lot easier these days. We do a lot of guided surgery. Okay. So basically the entire surgery is planned three-dimensionally on a computer. What used to take hours now, you're done in 10 minutes.
I love it. And now that actually reminds me of something I wanted to bring up because you're from Southern California, right?
I'm kind of from all over, but Southern California and Hawaii primarily.
Really? Hawaii?
Yeah.
That's fascinating. And you were in the music business for a while, I understand.
Correct.
And that's something we have in common because, I'm also production director here. And one of the things that is really important when it comes to especially post-production and sound engineering is precision. You have to, you know what it's like. With some of the modern software, we can zoom into thousandths of a second, right? And make sure that everything is just the way it needs to be. How does that precision tie into what you do as an implantologist?
Oh, everything in dentistry is measured in quarter millimeters.
Quarter millimeters?
It's everything has to be precise. From the placement of an implant, from the checking of someone's bite. We can feel an eighth of a hair with our teeth.
I'm sorry, did you say an eighth of a hair?
An eighth of a hair. We can feel, when we bite down, we can feel an eighth of a hair with our teeth. So everything has to be precise.
Wow, I had a scallop a couple days ago that had some grit in it. And I'll tell you, the grit, these are tiny pieces, but it felt like I had a mouthful of boulders.
You don't see the grit, but you feel it.
You sure do. Yeah. Wow, I didn't realize it was that precise.
Oh, yes.
When it comes, you don't think of teeth as being, they're hard matter. You don't necessarily think of them as being that sensitive, but I guess they really are, huh?
Well, what allows you to feel all that is you've got the ligament that holds your tooth in place, right? And so you can think of the ligament kind of like a mesh that holds your tooth to the bone.
Okay.
And when you press on it, that's where you're getting that sensation.
Wow.
So you're compressing the ligament, and the ligament is giving you that feedback.
I'll tell you, what an engineering. Just the mouth itself is an amazing just feat of biological engineering, right? So you're working with something that is a precisely tuned machine, really ideally, in the body. And you, through implants and through the other services you provide, you keep that machine running as smoothly and as healthily as possible. You can learn a lot more about Intercoastal Dental and Dr. Alex Gaeta by giving him a call today, 561-401-0532. Once again, that is 561-401-0532. Or you can head over to intercoastaldental.com. That's INTER, coastaldental.com. So what brought you into dentistry? What brought you into this area?
So what brought me into dentistry is a funny story. I was in the music business. I was telling you earlier that I'd met, one of the guys from Motley Crue, Mick Mars.
Mick Mars, the guitarist from Motley Crue, yeah.
And he was doing a session at a small recording studio I was working at in Los Angeles, and asked me to be his friend on MySpace.
Well, we're going back on this, huh?
Yeah, a long time ago.
I remember. Yep.
So I opened a MySpace account just so that I could be friends with Mick Mars, and I kind of used it as a resume page for all the music business that I'd worked on.
Makes sense.
Because all the artists were, at the time, that's what they were doing.
Of course. It's a Mick Mars. I mean, come on.
Yeah, yeah, exactly. So fast forward to 2008, I was looking for work. Everybody was looking for work.
I remember that.
And there was a job at University of Southern California School of Dentistry's continuing education department.
Okay.
And they were, for whatever reason, only advertising on MySpace.
Wow.
And I got the position, and that's what got me interested in dentistry. I worked 8 years basically doing, continuing education, taking educational classes in advanced dentistry before actually going to dental school. So I always tease that, Motley Crue got me into dental school.
Motley Crue got you into dentistry. It's funny, working on one passion, you kind of discover another.
Yeah, absolutely.
And it's funny, because for someone who has done all that you have, you become a fellow of the International Congress of Oral Implantologists. You were telling me how many, hundreds, thousands of hours it took to do that. You've obviously developed a real passion for dentistry and created something really special out of it. How does it feel to you when you've worked with someone and their problems in their mouth are gone? What is it? How does it feel to you to have someone so satisfied and so happy with their health at that point?
It's really exciting to see. Some people come in, they're in severe pain, they're nervous, they're scared, and you can usually take care of somebody and painless. And they walk. I call all my patients after a surgery, a day or so after, and just to check in on them. And I'd say the majority they're feeling great.
Wow.
It's pretty cool, and to have patients tell me that they didn't realize they were in so much pain until all of a sudden they were out of pain. They just got accustomed to being in pain.
And it can build slowly. You don't even really notice it, and then all of a sudden it's happening. And when that's relieved, it's hard for me to imagine, because we're using our teeth all the time. Yeah. We are always. They're sensitive to temperature. There's so many different things that can affect how our mouth feels. And if that pain is taken away, and when people can look in the mirror and like the way they look, I think that's really important. And it's a big part of it, isn't it?
It's not just pain management. It's not just health, but it's also cosmetic.
Yes.
You get to kind of touch on multiple aspects.
Right.
So it's one of the things that's nice in this career is that I still get to be an artist. So even though I've left the music business, I still get to be an artist. I just do it through a different medium.
Wow, that's one of the more interesting parallels, but it makes great sense. It really does, because you are an artist. The quality of the work that you do, Dr. Gaeta, there's nothing quite like it. You can learn more by heading over to intercoastaldental.com, intercoastaldental.com, or by calling 561-401-0532 to speak to Dr. Alex Gaeta right in the Seminole Shops, and you know the spot. It is 11940 U.S. Highway 1. He's in Suite 245 there. So let's talk a bit about the services that are offered at Intercoastal Dental. What do you do every day there?
We do a little bit of everything.
Okay.
We do family dentistry, cleanings. We do restorative dentistry, so fillings, crowns, bridge. Do surgery, like I was saying earlier. With I've got 2 fellowships, one with the International Congress of Oral Implantologists and another with the Mish Resnick Implant Institute.
Okay.
So obviously implants. Do a lot of extractions, bone grafting. Root canals. We're kind of a one-stop shop. We run
really
3D
are.
printers to, facilitate a lot of this. We do smile designs, full mouth reconstructions.
Now, that was a term you used before we went on the air.
Mm-hmm.
What is a full mouth reconstruction? That sounds pretty heavy duty.
It can be heavy duty. So sometimes patients will suffer from severe grinding, and it's something that they've just kind of suffered through their life. It doesn't necessarily hurt, but when you look at the teeth, they're ground down, they're chipped, and so people start to have their jaw collapse. Have
their jaw collapse.
Yeah. So let's say when you get your teeth, let's say at 16 years old, you got a full set of healthy teeth.
Right.
Yeah. Let's just pretend those teeth are 11 millimeters long.
Okay.
Right. And as you age through stress, you grind.
Sure.
So now that 11 millimeter tooth through, let's say, 20 years of grinding, 30 years, 40 years of grinding, now is all of a sudden 6 millimeters.
And that sounds, but I mean, again, the Grand Canyon was created through basically water grinding away at it over millennia. So, and when there's tooth grinding on tooth, that's a pretty powerful form of friction.
Absolutely. I mean, we'll put on our natural teeth over 250 pounds per square inch. So 250 PSI on natural teeth. Now, if you add implants to that, you're looking at almost 1,000 PSI.
It's amazing that you can have that much pressure going on, and people can do this in their sleep. They can grind and have no clue it's happening.
Oh yeah, you add a stressful career, family,
Modern
any stress,
life, really.
modern life, yeah, and next thing you know, you're grinding through your teeth, and you don't necessarily notice it immediately. It's something that happens over time. In some cases, I've had patients come in who've literally broken their tooth through the jawbone and it has to have removed because they stress out so much that they beat themselves up in their sleep.
Wow. It's wonderful that there is some kind of relief for this. It's great that they have the products and the services at Intercoastal Dental just to take some of that kind of a pressure off, because I can't imagine having it break through like that. And I'm a pretty high stress guy.
Yeah.
But thankfully of course, I should probably get in and check. I think I need to stop at Intercoastal Dental myself. I'm probably due for a cleaning at the very least. And that's another thing.
We'd love to have you.
I've got to come in because I take good care of my teeth, I think. I'm a regular brusher. I probably brush too long and too hard. I've probably damaged it just by force. But I'm a big flosser and everything. And I have the little metal hook set and the mirrors. Sometimes I'll do that. But, there's no way I can come close, even with that, to actually going into a dentist and getting a proper cleaning, getting it looked at, finding out where my teeth stand. I could have all kinds of problems and not know about them because I don't have a professional eye, and you do. You've got to stop in, check it out. Just see where you stand from an oral standpoint. 561-401-0532 or intercoastaldental.com. Let's talk about what an initial consultation would be like. What's it like when someone gives you a call and then comes in to meet you for the first time?
So they'll come in and, typically it's a full set of x-rays unless they've had x-rays taken within a year.
Okay.
We do a 3D scan. So it's all photographic based. There's no radiation involved in the 3D scan.
Okay.
And the scan is then brought up and we can kind of go over things and you can see your mouth from the inside of it, basically. Right. And then we go over the x-rays and we'll see if there's anything that needs to be addressed. And then we'll discuss those items and kind of set up a plan. My goal is to always have a comprehensive plan for a patient, because every time you just kind of do problems, you're just fixing a problem. You're not looking at the overall health.
Right.
So if you can come up with a comprehensive plan, then you're not just doing problem fixing, but you're preventing problems from occurring in the future.
And that's the way to do it. Preventive care is really what it's all about. You can find where that loose link in the chain is.
Yes.
Right? And
Yes.
and get that dealt with. And it can be, look, so many things can happen in the mouth. Everything from, and we can't see the back of our mouth. I mean, I can look in the mirror and smile all day. But I remember many years ago, I was a smoker. And I remember seeing the back of my teeth one day and being horrible. It's one of the reasons I quit smoking.
Yeah.
Because of the nightmare that I saw back there that you couldn't see from the front. It's not always obvious.
No, it's not.
When there is something wrong in the mouth. What are some of the things that people, besides grinding, for instance, some of the other things that people might not even know could be going on with their teeth?
I mean, I see cavities being a big portion of people typically associate pain
Right.
with teeth problems.
Sure.
And so they'll tell me, well, doc, it doesn't hurt. And so, okay, well, if you don't fix it now, it's going to hurt.
It's going to hurt later.
So, and it's, it's a simple procedure when it's just a small filling that's needed, right? If it's a small cavity, we take care of it real simple. We're done in 30 minutes to an hour. But as that cavity gets bigger, because it gets ignored for whatever reason, life happens, I get it. Then you're looking at potentially root canals, crowns, or extractions and implants, and it gets costlier and it takes more time. It's more invasive. I mean, the old adage of what is it? An ounce of prevention is worth
a
more
pound of cure.
Yeah, exactly.
And, well, that's a true story. And now is the time. And it's funny because I talk about this with regards to health in general. Getting things looked at before you have a symptom is the way to do it.
You have more options.
You always, and simpler options as well. So now is the time. I mean, especially if your teeth are feeling good, is the time to get them looked at to make sure they stay that way. And Intercoastal Dental is the place to go to do it. Intercoastaldental.com, intercoastaldental.com, or you can call 561-401-0532, 561-401-0532. Dr. Alex Gaeta, my guest today, here on Business Community Spotlight. So how long have you been in this area, right here in the Palm Beach County area?
I moved to Palm Beach County in 2017.
Okay, so you got a few years.
So I've got a few years here. I've been practicing in this area since I arrived.
Okay.
And then we opened our office this last year, actually. So we've been open about 7 months now, and it's been a dream of mine for a while. So it's really cool to see it come to fruition, and having this nice spot. I've always wanted big windows to see outside, and I've got all the natural light that I wanted, and the staff has been great. It's been really cool to see, my vision going from a scribble of paper to a 7 operatory office.
Wow.
So it's been pretty cool.
That's like a manifestation thing. You made it happen. But you do that through doing good work is the thing. I mean, you're not going to have that level of success by doing average work.
No.
It can't happen. And especially, I mean, here in Palm Beach County, there's a degree of people wanting excellence.
Absolutely.
And obviously, Intercoastal Dental fulfills that need for excellent care. And, I mean, Seminole Shops, which has really had something of a renaissance over the past couple of years. How do you like it there?
It's great. I mean, we've got just a bunch of different places to eat. That's really nice. We've got places to shop. I mean, there's plenty of parking. I'm just a few minutes away, so it's like my commute is 5 minutes.
There you go, right?
I mean, assuming the bridge is down, right? So,
yeah, I live 2 bridges away from here.
Okay.
So I'm always kind of trying to time it up,
So no, it's nice. I'm real happy. It's it took a while to find it, and once I found it, I knew Seminole Shops was the place. So
you've got a personality that to me is just. You're very relaxed. You're very friendly. But my sense also is that you really have a caring for the people that come into you to have you take care of their mouth and teeth. Why Why is that so important to you? I mean, you just have this kind of an energy that I'm like, wow, he really is legitimately concerned with the well-being of his patients. And one of the first things he said to me was that when you take away somebody's pain, it's gratifying for you. So let's talk about why that is. Why are you so passionate about it?
You know, it's interesting because I've always had good things. A lot of people are, I guess, afraid of the dentist.
Yes,
and for me,
a lot
dentistry has always been a positive thing.
Right.
My father is a dentist,
okay.
and he practices in Hawaii. And so I just seen him take care of people. And, you know, I've seen a lot of friends and mentors take care of people. And now that I'm in a position to do that, it's nice to be able to help people. And I've enjoyed it. I've always enjoyed it. I've always wanted to help somebody out when I can.
Right.
You know, and so taking somebody, whether it's taking somebody out of pain or, you know, giving somebody the smile design that they're looking for, or just restoring their natural health back to, you know, a state of healthy.
Sure.
It's all gratifying. And, you know, it's some patients, I feel like they truly appreciate it. And that's, I think that's really cool. That's really powerful. I get to put my mark, you know, on somebody's life, and they might not remember me in 5 years. They might
right.
They're healthy. They're happy. They're, you know, I mean, it's I get to kind of put my stamp on and help somebody else. And
I love that. I think that's a great thing to say, because it's funny how often this quote comes up for me. So when I'm talking with people in the health field, but in one of the novels, Stephen King wrote that pain is the great tyrant.
yeah.
And it is. It is. When you're in pain, even if it's a slowly developing pain, you're not even aware it's there sometimes. It is affecting you. It's taking away from your quality of life. And without a professional, there's nothing you can do about it. And that's where something like implants comes in. That's where something like dealing with that pain comes in, because it is so freeing. You can be in shackles and not even really know it because you've gotten used to it.
Yeah.
Or, you know, and that's where you come in when it comes to freeing people like that.
I've had patients tell me, they'll tell me, I didn't realize how bad I was hurting for these last 5+ years until I came to see you, and now all those problems are gone.
They're gone.
And they're like, I sleep better at night. My head doesn't hurt. You know, my arms don't ache. I mean, the pain will travel from the top of your head down the side of your arm, and people get accustomed to it. I mean, people can be pretty resilient and deal with a lot.
Yeah, we can.
And when you remove that pain, or you restore that smile, or, I mean, whatever somebody is looking for, when you can help them achieve, you know, one of my questions I ask all my patients is, what's your goal? Because there's a lot of things we can do. A patient can come in, if their goal is only to be out of pain, then let's do that.
Right.
If their goal is to be out of pain and then, you know, be able to chew on that portion of their mouth again, okay, well, let's do that. If their goal is, I don't want to be in pain anymore, and I want my whole mouth to be white, and I want my, you know, smile restored, okay, great, let's do that. And everybody's priorities are going to be different.
Sure.
So the biggest thing for me is always get somebody out of pain. That's priority number one. Everything else comes second. And if somebody's not in pain, then great. Then let's do preventative. And if you have a goal that's in your mind's eye, then let's figure out what we can do.
Make it happen. And I mean, nowadays also, I mean, that the image is so important, especially here in Palm Beach County, right? And I'm on stage a lot. So with me, it's like, dude, the smile is important. We lead with it. The mouth it's kind of a two-way thing, because it's the gateway in with food, with nutrition, all of it. It's where everything starts. It's the first gatekeeper, right? Mm-hmm. But it's also the first thing that people notice a lot of the time. They notice that smile. If you're speaking, if you're speaking clearly, and believe me, teeth, mouth, lips, tongue, they have so much to do with diction, right? Health of the mouth is important practically. It's important cosmetically. It's just extremely important overall. And that is where Intercoastal Dental comes in. If you have pain, if you have appearance issues, if you just need to have it looked at because it's been a while, you need that cleaning, you need a family dentist, all of it happens at Intercoastal Dental with my friend Dr. Alex Gaeta. He's a doctor of dental surgery. He's a fellow of the International Congress of Oral Implantologists. There's not much he can't do, and he does it with passion, with caring, and with real heart. And I'm definitely getting that from this conversation. Intercoastal Dental is right in the Seminole Shops, 11940 US Highway 1, Suite 245. That's, of course, on US 1, just a little bit north of PGA Boulevard. 561-401-0532 is the number. 561-401-0532. And the website, once again, is intercoastaldental.com. Intercoastaldental.com. Dr. Alex Gaeta, thank you so much for taking the time to come in and talk with us today.
My pleasure. Thank you for having me here, Mike. Yeah. I really appreciate it.
Of course. Great conversation. Keep rocking. And
same to you.
I will be in to get everything looked at myself because I really, really need to. So I'll look forward to seeing you there. 561-402-0532 for Intercoastal Dental. This is Business Community Spotlight on a South Florida Sunday morning. Mike McGann here with you. Stick around. Lots more legendary programming on the way.